Blood pressure is a measure of the force of the blood against the walls of the arteries as it's pumped around the body by the heart. It's expressed in millimeters of mercury, mmHg, and is typically written as two numbers such as 120/80. The first number is the systolic blood pressure, which is a measure of the force of blood in the arteries when the heart beats or contracts. The second number is the diastolic blood pressure, which is the measure of the force of the blood in the arteries when the heart is resting between beats. High blood pressure, also known as hypertension, is a common condition that occurs when blood pressure is consistently too high. It's defined as a blood pressure reading of 140/90 or higher. High blood pressure can damage the arteries and the heart and other organs, increasing the risk of heart attack, stroke, kidney disease and other serious health problems. Low blood pressure, also known as hypotension, is a condition when the blood pressure is consistently low. It's defined as blood pressure readings of 90/60 or lower. Low blood pressure can cause a person to feel dizzy or lightheaded. It can also lead to fainting. While low blood pressure is not usually a serious problem, it can be a sign of an underlying health condition that needs to be addressed. There are several factors that can affect blood pressure, including age, gender, weight, and family history. Other factors that contribute to high blood pressure include stress, smoking, a sedentary lifestyle, a diet high in salt, and the use of certain medications. Blood pressure is typically measured using a blood pressure cuff. The cuff is placed around the upper arm and is inflated to block the flow of blood in an artery. As the cuff is gradually deflated, a device called a stethoscope is used to listen to the blood flow through the artery. The point at which the blood flow is first heard is the systolic blood pressure, and the point at which it disappears is diastolic blood pressure. It's important to have your blood pressure checked regularly, as high blood pressure often has no symptoms. If you have high blood pressure, your doctor may recommend lifestyle changes such as eating a healthy diet, exercising regularly, and quitting smoking to help lower your blood pressure. You may also need to take medication to lower your blood pressure.